Hi, my name is Chris Borkowski, and I'm the practice administrator for our Cherry Hill location of Eleanor Health. I want to start by thanking you all for joining us today and express how excited we are to be in New Jersey and part of the Cherry Hill community. Our hope is that you will learn a little more about our passion for care and that this will be the first step in building some great relationships within this community. I've worked in the tri-state area as a member of the behavioral health field for the past 15 years. During that time, I don't know that I've ever seen a clinical model quite like what we're doing here at Eleanor Health. Eleanor really embraces the whole person approach, and we find ways to connect and support our members regardless of circumstance. That want to connect doesn't fade due to stay-at-home orders. Our company was built from the ground up to fully utilize technology to deliver care effectively. We can provide 100% of our services remotely. In fact, that's how we are initially launching our services in New Jersey. We will open our physical doors in the future, but our virtual doors are open starting today. Before introducing our co-founders, I want to set some quick house rules. You'll notice a chat window on the right-hand side of your screen. Please feel free to use that chat box throughout the event to interact with our team and your fellow attendees. Once you click on the chat box, you'll notice there's two options to either speak directly to our panelists or to your fellow attendees. In addition to the chat, there's a Q&A box at the bottom of your screen. You can type in any question there, and we'll be answering them throughout the open house. I would like to officially kick off the event by introducing one of our co-founders and CEO, Corbin Petro.
Thank you, Chris, and thanks to all of you for joining us this evening. We're so happy that folks from the Cherry Hill and broader New Jersey community have joined us. I also want to give a special welcome to the entire Eleanor Health team on the line as well. We have teams from across our clinics in North Carolina, where we have 5 clinics, as well as our statewide and national teams. Eleanor Health's mission is to help people affected by addiction live amazing lives, and that mission is more important now than ever. Many people have been using alcohol and other substances to cope with the uncertainty, anxiety, and isolation that we're all experiencing. And those with addiction are significantly and negatively impacted by these unprecedented times. As we embark on the second wave of the coronavirus, our mental health, we know that our work will continue to be critically important, whether we meet people in our beautiful, warm, and welcoming clinic in Cherry Hill, in the community, in patients' homes, or virtually all across the state of New Jersey. Eleanor Health was founded with the goal of expanding access to the highest quality evidence-based treatment, including the use of medication-assisted treatment, and addressing whole person, non-clinical aspects that are so important to retaining a person in recovery. I'm excited to kick it over to Eleanor's co-founder and Chief Medical Officer, Dr. Nzinga Harrison, to share a bit more about our clinical model. But before that, just wanted to thank you all again for joining us tonight and for helping us celebrate the expansion of Eleanor's mission into Cherry Hill and to people all across New Jersey.
Thanks, Corbin. And thank you to New Jersey, who is giving us an amazingly warm welcome with so many attendees to our first purely virtual launch. As Corbin mentioned, I'm Dr. Nzinga Harrison, psychiatrist and addiction medicine physician, co-founder and chief medical officer for Eleanor Health. You'll actually see more details about our clinical care model later in the program, but what I always want people to know about us is that the guiding foundation of our clinical care model is the longitudinal relationship. We believe that the relationship creates all opportunity for health. And so, as Corbin mentioned, many people are noticing themselves having a lot of distress in the face of COVID and social distancing. We are here to help. We take care of people at every phase, whether just worried about what my use is or knowing that I have a problem with my use, actively using, in remission, early in recovery. We're here to wrap our arms around everyone, leading first with compassion through a model that is evidence-based and data proven. And so we appreciate you welcoming us to your community. You'll notice throughout this time together in the open house that we don't refer to the people we take care of as patients, but rather as community members. So as we're joining your community, we hope you'll trust us with your loved ones and the people you care about to join our community as we work towards helping people affected by addiction live amazing lives. And so with that, I couldn't be more excited to pass it over to our third co-founder, who will be taking over leadership of New Jersey as the general manager, Christie.
Thank you, Nzinga. Good evening, everyone. Welcome to Eleanor Health, New Jersey. My name is Christie Merchandani, and as Nzinga mentioned, I'm co-founder of Eleanor Health and recently general manager of New Jersey, and couldn't be more excited to be taking on that role. We're thrilled to be bringing Eleanor Health to New Jersey communities and to serve the people and the neighborhoods of this state. As we see across the country, many are wrestling here with substance use and related mental health needs. And we believe that Eleanor can become a core part of their recovery ecosystem, integrating alongside the community with other healthcare professionals, other sites of care, and the resources here to best support our community members. Eleanor exists because of this fundamental belief that all people have a right to a full life and that health is at the very center of that commitment. We are honored to be one part of improving health and honored to keep pushing, to keep creating, learning, and collaborating in order to deliver a system of care that has resources allowing for remission and recovery on these journeys of our community members. Thank you so much to everyone here for welcoming Eleanor to New Jersey. And I'm excited to hand it back over to Chris before we share a short video about that journey of bringing Eleanor into the state.
Thanks, Christy. There are few places in the country that feel quite like Cherry Hill, New Jersey. We have the ability to stop at our farm on our way home from the beach before going to the mall to prepare for a concert in a major city. We can do all of that within 2 hours' time. That's pretty incredible. Speaking of incredible things, we've put together a video that demonstrates a little more about what makes Eleanor Health so special. Enjoy.
Our mission at Eleanor Health is to help people with addiction live amazing lives.
We strive to create a warm and welcoming environment. When you walk through our doors, physically or virtually, we want you to be seen and to be heard, not to be judged, but to be supported on your journey to recovery.
We are experts for sure in the treatment of addictive disorders and co-occurring psychiatric disorders, but our members are experts in their experiences, and they're experts in who they are as people, and they're experts in what holds meaning for them. And so we value those two expertises equally.
I am so excited to be working for a company that wants people with addictions to live amazing lives. And it's phenomenal hearing people's stories. So many of them can't help but tell us, I've never felt respected before until I came to Eleanor Health.
I've lived in New Jersey most of my adult life. I couldn't be happier that Eleanor has decided to move and expand into the New Jersey market.
It's very exciting to be launching Eleanor Health's second market, particularly in New Jersey. In the state of New Jersey, we've had the opportunity to cultivate relationships with community stakeholders, health plans, providers, and recovery support organizations. Because of those relationships, I am thrilled for our future community members to be supported in many dimensions to make them most successful on their journey to recovery, and with Eleanor's place in that infrastructure as an outpatient treatment provider to complement the rest of the resources in the state of New Jersey.
We're incredibly excited to be entering into Cherry Hill, New Jersey. It's our first foray into New Jersey, our first clinic opening. I think it's challenging during this time. Obviously, we're all confronted with social isolation, with the coronavirus, and really opening our doors in a virtual fashion is exactly what the community needs right now.
The entire company was built from the ground up to support technology and to grow. Our entire care model can be done virtually.
Our virtual services are inclusive of medications, individual and group therapy, our psychiatric services, management of co-occurring conditions, and interactions with our community recovery partners.
We use technology to reach out and help individuals who might not be able to get the help otherwise.
So what is really genuinely special about Eleanor Health is that we tell our people, no matter what, just come back, because our relationship with you is not contingent on your ability to control the symptoms of your illness. We have the same goal, which is for you to be healthy and for you to be alive. And we feel like the best way we can march towards that goal with a person is to maintain the relationship with that person in sickness and in health, right? We do not kick patients out.
We truly believe that each person that comes to one of our clinics is a member of our community.
And we are completely prepared and willing and able to walk with you. You will get safe, excellent care overseen by a nurse care manager, medical staff, licensed therapist, and a recovery coach.
We want to help as many people as possible achieve their best life. I think we've done a great job so far in North Carolina, and I'm excited to bring this model to the New Jersey area.
Eleanor Health is built on the principles inspired by Eleanor Roosevelt. One of her most famous quotes is, "With the new day comes new strength and new thoughts." That's exactly the environment we strive to create for every single one of our community members.
I love this phrase that we use, hashtag recovery for life. Your life can be amazing.
All right, before we start our Q&A, I want to introduce two members of the Cherry Hill team and have them describe how their roles will be supporting our Eleanor Health members. We will start with our lead clinician, Kaya Daly, and then we'll hear from our community recovery partner, Shane Pamalis. Kaya?
Thanks, Chris. Hello, everyone. My name is Kaya Daly. I am the lead clinician, like Chris said, of Eleanor Health in Cherry Hill. I'm a behavioral health therapist with several years of experience working in outpatient settings, both military and non-military. I decided to join Eleanor because I'm really excited about how Eleanor does the work differently. Being an experienced provider working in the field, I've never worked for a company that actually treats the whole person. A lot of people talk about it, but they don't really do it, and Eleanor really does it. It's a place where an individual can walk in and be seen by a doctor, nurse, community recovery partner, and a therapist in one day, and that's truly amazing. I look forward to meeting community members, building relationships with community members, as well as other providers in the community, and working with this amazing team to help grow the Cherry Hill site. And with that, I will pass it over to Shane Pamalis, our amazing community recovery partner.
Thank you, Kaya. Awesome. Hello, everyone, and thanks for being here. My name is Shane Pamalis. I'm the community recovery partner with Eleanor Health, New Jersey. And being the first point of contact with our members, I get the opportunity to share experiences and get them to a place where being open and honest with the Eleanor team will feel like second nature. And I'm really excited to assist our members live their best lives. And having lived in New Jersey for most of my life, I feel that I'm well equipped to connect our members with the resources they need to succeed. And being a CRP means that I have the chance to give back to the recovery community on a person-to-person level, and that's really exciting. All right, and back to you, Chris.
Thanks, Shane. Thank you, Kai. So now we're going to start our Q&A. Looking at the box, the first question is, how do you start virtual care? It's a very important question in these times. I think I will see if Nzinga would like to answer that question.
Sure, I can answer that question. So we try to make it as easy as possible for you to get to us. You can call us, you can go to our website and schedule an appointment request directly from there. We can do our entire model virtually thanks to regulations that have changed as a result of coronavirus. And so you'll immediately be connected to our nurse, Shane, our community recovery partner, and we'll get you set up through our secure, confidential telehealth platform to get you connected to Kaya and your physician and the rest of your treatment team. So just reach out to us. The website is a super easy way. The phone number is also there. And we offer same-day appointments. So when you need us, we aim to be there.
Thanks, Nzinga. The next question is, do you accept insurance? We absolutely do. And Christie, I believe, would be able to speak more to that.
Certainly. Thanks, Chris. We do accept insurance. And in fact, Eleanor is really built on a main goal of expanding access to comprehensive evidence-based treatment. Insurance coverage and making sure that we expand that access is really important to us. Today in New Jersey, we're very proud that we're in network with Horizon of New Jersey for all of its lines of business, includes commercial, Medicare, and Medicaid plans. And we continue to build out their relationships across the state for additional health plan coverage to best serve the state of New Jersey, while also offering self-pay options for those who prefer it.
All right, thanks, Christie. The next question is, do you need a referral for services? You do not need a referral for services. You can just give us a call, go to the website, and we have someone staff that will answer your questions, and we'll give you any information you want and get you in same day. So the next question is, how do you address the family system in your treatment model? Family is extremely important to us, and we believe that that's a big part of what our model is. Hannah, would you like to speak to that?
I'd be happy to. Family is very important for part of care. We can serve family members impacted by substance use in their families with direct care as part of our Rising Risk program, so they can access therapy and other services as needed. We also can incorporate family members in the care provided to members. So if you want to have a session and invite your mother or your spouse or your child to join you as part of your treatment journey to be a support, you are absolutely welcome. We also want to make sure that we're helping people keep safe and that we're getting releases of information for your chosen family or however you define family, so we can reach out to you if you're struggling.
Okay, the next question is, how did you pick Cherry Hill for your first location? I think we picked it because it's the greatest city in the state, but also I think Srishti has more information about that. Srishti?
Certainly. Of course, what Chris said. A big reason we picked Cherry Hill, though, was doing a significant amount of analysis and talking with the community to understand where Eleanor could first set up its physical presence. So again, we're launching virtually, but our very first site of care that will open its doors in New Jersey is based in Cherry Hill. Cherry Hill is at the confluence of a number of different neighborhoods, accessible actually across to Pennsylvania, but also to many different areas and communities in New Jersey. We're also really excited by the resources that are available in Cherry Hill across different sites of care, both primary care providers, other behavioral health clinicians, to work in tandem with them to best support our community members, as well as community support organizations that help to address the social determinants of health and recovery capital on that journey. Cherry Hill is right at the nexus of all of those resources, and so it's one of the key reasons that we're here opening our doors in Cherry Hill.
Thanks, Srishti. The next question is, how do you deal with urine drug testing virtually? I think that Nzinga could speak to that.
I sure can. So this was one of the biggest things we had to figure out as we moved into being able to accept new members virtually. So we will actually ship the urine drug cups to you, and then you save that cup until you're actually on camera with one of our members. We are clearly not doing observed drug screens, but you can show us the empty cup, and then we use point of care where the results show up directly on that cup. So once the cup has the specimen in it, you can show that to your nurse on camera, and we document, and then we can use it to help guide our treatment decisions. I always say, when we talk about urine drug screens at Eleanor Health, you heard in the video, we do not kick people out for having symptoms of their illness. And so the way we use drug screen results are as relationship building, the ability to have honesty between the people we're taking care of and to help guide our medical decisions safely, never ever punitively or with negative consequences attached.
Okay, thank you. The next would be, which evidence-based tools do you use? We use a lot of evidence-based tools, and I think Hannah would be great to answer that question.
Thank you, Chris. All of our therapists are trained in cognitive behavioral therapy. Many of them also have other specializations. We make sure they are also trained in evidence-based trauma-informed modality. Kaya has some excellent skills that she'll be bringing in there. All of our CRPs, besides the peer specialist training that they come in with, get trained in motivational interviewing and behavioral activation. We also, of course, our prescribers are all data waiver trained. We provide additional training in medical protocols. Our Chief Medical Officer, Dr. Harrison, stays up to date on all the best research. regarding care. And we are continuously changing our protocols and medical models for opioid care, benzodiazepine tapers, people who are pregnancy care. We have an OBGYN on staff that helps us with our protocols as well.
Thank you, Hannah. How do you handle members who relapse? That's an excellent question. And Hannah, would you like to continue right along with that one?
Absolutely. Part of when somebody relapses, just like when somebody with diabetes has an A1C that's higher 1 month, that their kidney function isn't as healthy as before, you need to change a treatment plan. What we're doing isn't working as well as we hoped. And so when somebody does have relapse, we want to talk about that. We want it to be a safe conversation. We would never fire anybody for having a more severe condition, just like your PCP would never fire you for your diabetes getting worse. And so we look at all different aspects of that treatment plan. We have a root cause analysis process where we're looking at different domains of recovery capital to see how we can help. Is it our care? Is it social supports? Is it employment related? Is it we need to increase intensity of group therapy? How can we support and help people be successful? Because we believe everyone can be successful, achieve recovery, and avoid relapses if we have the right care.
That's great. Thank you, Hannah. Someone else also asked, can I continue to see my own doctor as well? And I can take that. And absolutely, we want you to see your own doctor. This is a treatment team. We want your doctors to talk to our doctors. We all want to coordinate care together to help you in the best way possible. Do you plan to expand to other areas of New Jersey? I hope so, but Christie, is that part of our plan?
It's absolutely part of our plan. So we will, as of today, our doors are open to serve all of New Jersey virtually. We will also continue to expand our clinic footprint across the state of New Jersey. We're already looking at where that might be next and would like to serve all different pockets of the state of New Jersey really over the coming months. When it's safe to be opening up our clinic doors, we'll start with Cherry Hill and pretty quickly expand to cover the state.
All right, thank you, Christie. What does whole person care mean? What does it include? Nzinga, would you like to take care of that one?
I would love to take care of this one. So whole person care means that we know getting better cannot be measured only by a urine drug screen. It means an entire person with relationships and feelings and emotions and physical health needs and mental health needs and connectedness needs and support needs walks in the door. And so when we say we take care of the whole person, we really want to get to know, what are your hobbies? What is an amazing life as defined by you? What are the barriers to you being able to have that amazing life? And then we set about to help you resolve those barriers. The specific interventions that go into whole person care are: one, access, right? So we commit to be there when you need us. We commit to same day access. Two is mental health care. So we know that 80% of people that come in concerned about substance use also have another psychiatric disorder, whether that's depression, anxiety, bipolar disorder, ADHD, schizophrenia. We hold our psychiatric care in-house. So we have psychiatrists and psychiatric mental health nurse practitioners available to provide that care. Our nurses help to manage physical health care, right? So we know there's a relationship between mental health care and physical health care because the head is attached to the body. And so helping you recognize what impact diabetes is having on your quality of care, hypertension, helping you navigate the healthcare system. And then recovery capital. We use a psychometrically validated scale, which measures 35 social drivers of health: stability, meaningful connectedness, citizenship, right? Involvement in volunteer activities. And our community recovery partners literally work with every single person to craft what that amazing life definition is and remove those barriers to reaching it.
Thank you, Nzinga. There's a question that states, are there still face-to-face options for appointments if needed, wanted? I think it's interesting in the COVID environment, the pivots we've had to make and the expansion of doing so. Corbin, would you like to talk about that and what we can do moving forward?
Sure. So what we did in North Carolina is obviously move from a a heavy face-to-face model. So we moved where we obviously were able to deliver most of our care virtually, but found that many of our community members preferred to come into our clinics. We transitioned them to virtual care. As we enter into New Jersey, our intention is to start to serve patients primarily virtually through our virtual model. And as it becomes safe to open our clinic, that's when we'll have face-to-face meetings. To the extent that a patient is very interested in a face-to-face meeting, we've explored creative options in North Carolina, like seeing patients in the car and other modalities. And I think that's really up to Chris and the Cherry Hill team on how they want to better meet the needs of their community.
Thank you, Corbin. As you mentioned, we know that many of our folks affected by addiction issues also experience co-occurring mental health disorders. How do you plan to address these related issues, either in-house or through consultation with other providers? We want to build as many relationships with providers as we can, and I think Hannah would be great to speak to that. Hannah?
Yes, absolutely. So we provide thorough training to all of our staff, including our peer supports in anxiety, disorder, and depression care. 1 month after our 40-hour training, we have a special anxiety and panic disorder training for all of our clinic staff, because anxiety is a core feature of recovery, and especially in early stages for folks tapering from benzodiazepines or recovering from opioid or other disorders. We also serve folks with other long-term mental health disorders, including schizophrenia, bipolar disorder, etc. We have wonderful psychiatric staff in-house. We have a wonderful psychiatrist, Dr. Crystal Carrington, who's in our New Jersey team, and she is fabulous. We also have psychiatric nurse practitioners. Dr. Chartier is one of our folks serving the New Jersey, North Carolina teams, who's duly licensed in both states. And all of our psychiatric staff are also trained in and data waivered in appropriate medication care for addiction care as well. So that's fantastic. And then everyone has access to our licensed therapists to receive individual and group therapy, because we know that therapy is often a wonderful first line approach for mental health challenges, needs, and just plain out stress.
Thanks, Hannah. How many members do you think the Cherry Hill area will be able to serve? Srishti, I think you could speak to that.
Sure. So as of opening our doors, our capacity is in the hundreds. We will continue to grow that capacity. Our team is the strong team that you see here, as well as some of the folks that are on the call but not speaking today. But we'll continue to grow that capability so that we're really able to serve the demand of not just the Cherry Hill area, but across the state.
Thank you, Srishti. So how long is the program from intake until graduation? I think this is a great question to see how long someone will be a member of Eleanor Health. And if we only had some type of, I don't know, slogan or hashtag for that. And Zinga, is there anything you know?
I have heard this hashtag called Eleanor for Life. So the quick answer is that we literally hope you will join our community and become an alumnus and stay with us for life. The first year of our program is mapped out in phases. We aim to have a relationship no shorter than 5 years after remission, because we know that the literature tells us that at 5 years after remission, the risk of relapse falls to that of the general public. And so even though after those 5 years, we hope to stay engaged with community events and social events and through technology and through appointments. Eleanor for Life is both for our community members, but also for those of you who join us, shameless plug, as team members in Eleanor Health, New Jersey.
Thanks, Nzinga. John asked 3 separate questions. Are you using counselor interns? How are you connected to recovery supports in Camden County? Will you join the professional community that exists here? We absolutely will join the professional community. It's one of our main goals. We want to build resources. We want to connect. We are using all licensed therapists, and we are starting to build those connections. Thanks, John. And are you continuing to hire CRMPs? Hannah, would you like to answer about who we are hiring, what we are looking for, and the services that we offer?
Absolutely. We are, right now, we have a wonderful nurse care manager as part of our team starting, I think, in a week. We also
have a therapist on our team and a certified peer specialist, Shane, as our community recovery partner, as well as our psychiatric staff and medication-assisted treatment staff in New Jersey. We do not have a CRMP right now on staff, but we are looking forward to expanding our staff in the future. Also saw a question about counselor interns. We do not have this part of our model right now, but as we grow and expand, we do hope to integrate and help train the next generation of counselors.
Thank you, Hannah. Well, those were a lot of questions, a lot of great answers. I hope everyone got a lot out of this. I want to thank everyone for coming and all the great questions that were asked. Feel free to keep asking more and reach out to us on our website at eleanorhealth.com. I personally had an incredible time tonight, and I'm looking forward to connecting with you more in the future. I want to now pass it back to our co-founder and New Jersey General Manager, Christie Merchandani, for some closing comments.
Thanks, Chris. I'll keep it brief, but just wanted to say a thank you again to everyone for joining us here today, and most importantly, for welcoming us into the New Jersey community. We never expected just a couple of months ago that we would be opening up our services in this way, but we're incredibly proud of our ability to serve community members for their needs for addiction treatment and recovery support in this fully virtual model today, and continue to serve them as our clinic doors open in the future. Thank you, everyone. Please stay engaged with Eleanor Health and this team via our website, via our personal contact information. And if you are looking for connecting to services, please visit our website or connect to the phone number available there. We'll show it up on the screen so that you have quick access to it, and we look forward to staying in touch. Take care, everyone, and have a great night.